And I think what I've learned through all the research that I've done is that the best possible treatment is not always the most expensive treatment. And for instance, prostate cancer right now, which all of us unfortunately will have to tangle with at some point in our lives if we live long enough.
Oh boy.
Prostate cancer, there are 4 or 5 treatments for it right now.
Right.
And do you know that the treatment that is the most popular today is the most profitable today?
Not necessarily.
I was saying I was answering
yeah.
popular.
So again, but it gets back to the profit motive. So instead of having real research to say if there's 4 or 5 options, which one really is the most promising? What's happening is the one that's the most profitable is the one that's being prescribed the most often. So these are the kinds of things that if we can have help, if we can have coaches, we want to make sure we're getting better care. And so it doesn't always equate with the most expensive care. It's much more in depth than that, and that's one of the things that's not being done.
So
today.
we're saving you money by using these coaches.
So we're saving ourselves money because you're playing with your own money now, right? So you have skin in the game, as they say.
So I'm going to take care of my own self.
Yeah, you don't want to run out of that pool of money before the end of the year, so you're going to be more careful. And then if there's something catastrophic that goes over and above those cash expenses,
absolutely
I'm not going to spend.
You've got catastrophic insurance.
Even though the company is self-insured, we have catastrophic insurance. So if anything else happens, that God forbid you need something else, and it's very costly, we're insured for that. We pay an extra premium for that to make sure we're covered. So everybody is covered. You know, on the if you take the real downside case, everybody is covered there. To take an appendectomy, if something like that happens, an emergency procedure, there are millions of these things done a year across the country. It would be nice to have somebody there that's going to be on the telephone with you. They have all the data on how long it should take, how long you should be in the hospital, what's the best medication to be on. And so they're there to act, but now you and I don't know those questions. No. If you have somebody there that's going to be helping you ask those questions of the doctor to ensure that you're getting the best possible care. That's really what it's all about. That's
so you could be paying $10,000 for a procedure when there's a procedure and a doctor out there who can do it just as well for $3,000.
Who could do it better for $3,000? That's what
I like to do it better part.
The job one is quality. Job one is quality, because I'll tell you why, Larry. If you get it done right the first time, whether it's $3,000 or $5,000 or $7,000, if you get it done right the first time, you're out of there, you're back up on your feet, you're healthy and productive again. If it's not being done properly, or you don't have the right physician, or that physician's track record isn't best in class, which we want to make sure, and we don't know, we're relying on the doctor there. If we have somebody who has all that data and can help us and steer us into or away from those kinds of problems, it's the readmittance that's so expensive. It's because they didn't do it right the first time. And then you have to go back, and those are what we have found have racked up the big bills. So it's not trying to save money up front, it's trying to get the best quality care so you can be in and be out and not have to have lingering problems and get it done right the first time.
Is the whole plan for everybody going to be one-size-fits-all HSA, or do you have still the PPO option, or how's this?
You still have the PPO option. With the HSA option, what we've done, because again, we're seeding the HSA, as I mentioned, with 30%, and that's your money to take with you. And
you're just beefing that up because you see that as the best way forward to cutting costs.
Well, we see that as the best way forward to having everybody have a vested interest in their health care. That's really, at the end of the day, what we want to do.